So we're here this morning in the MAC, New Script for Mental Health. It's World Mental Health Day, and we're really excited to be launching a new mental health initiative called Give 5, Wellbeing Framework, Rights-Based Framework for Mental Health.
So Give 5 is focusing on what governments and organisations can do to better tackle the mental health crisis. Take 5 Steps to Wellbeing is a public health campaign that focuses on what individuals can do. We can't have one without the other. We're really excited today, and with conversations we've already had, that there will be people in the room endorsing Give 5 framework. We're calling on governments to show leadership in making sure that Give 5 is integrated to all aspects of mental health.
I stand here today and I find it deeply upsetting sometimes to be in these rooms because I'm standing with people that have been let down and are bereaved. But I stand here today because our community took a stand. Our community took a stand and started the process of trying to find our own solutions.
So we have to ask the question, how do we, as society, how do we change this? As humans, we all need things to keep our mind healthy. We need connection, we need meaning, and we need a sense of purpose. There's no better way to finding this through the power of creativity.
Dignity and human rights. Our mental health and well-being is not a privilege, it is a human right. Like many families that are here, I stand for you as one family that had been bereaved by suicide not once but twice. I have learnt that it is the compassion of others, my own compassion, my own creativity and the creativity of others that it has guided me and kept me going.
Systems are causing harm. They're not reducing harm. They are compounding traumatic stress and loss, and cynically trying to fix the mechanics of the system to the detriment and loss of people's lives and to the quality of people's lives is losing what it means to be human.
But there's always a backstory to every single one of our stories. What's happened before it? We only deal with the death. The inquest only deals with what happened that day. We need to look further so we can learn from these mistakes. So the reason when I talk about it and the reason I come and tell my story is because I've learned lessons learned, but they aren't being learned.
I have huge respect for those that are trying to support within a fractured service, but also the dignity in which we need to hear the voices of those that feel fractured and broken. And it is through our brokenness and in our fractures, that's how, as Leonard would say, that's how the light gets in.
Kenneth will most certainly be delighted to be endorsing this. We look forward to working in partnership with everybody in the room.
I love the Give 5. I think it has a real hope to it. There's nothing in it that a psychologist I would fully sign up to. And as a head of a service, I would fully sign up to it. I think the challenge is, how do we find a space between people who receive services and those who try to deliver services, remembering that all of us have mental well-being challenges.
To come into rooms like this, to get the energy, to get the power, it was the first time that I thought, God, we're in a room where we don't have to explain why this is important. But let's use it. Let's get it all together.
Well done with everybody that was involved in it. I'm just so happy I came here this morning. I've learned a lot, and I know we have a lot of way to go, but I think with this sort of energy and determination, anything's possible. So well done.
This was a very meaningful event, I think. I liked very much the testimonies by people who give evidence that mental health system is not working. For consolation, I can say it's a global problem. And each country should contribute to how to move ahead. I'm happy that in Northern Ireland you have a very good grassroots movement, because this new script for mental health, this Give 5 initiative, is exactly in line with the recommendations of United Nations, World Health Organization. I wish success, and I hope that government will take seriously this very good suggestion from civil society.